Okay, good afternoon. First thing I'd like to do today is to start with an update from our Department of Labor. We have brought on Accenture to assist with technological assessments and improvements to support the delivery of unemployment services. Accenture will be working on a fast timetable to improve the unemployment system and services through evaluating and providing recommendations for claims, processing optimization, call center operations, and a comprehensive technology review. Accenture has broad experience in this type of work, including assisting more than a half a dozen other states with COVID-related programs during the pandemic. They are on the ground now here in Kansas to begin a first phase of the review and initial operations for actionable steps, followed by additional data gathering, analysis, and weekly recommendations for the duration of their work. With Accenture's help, I'm confident that we will soon have a plan in place to deliver services quicker and to help us prepare to handle future stress on the system. Once again, to all Kansans struggling to get their unemployment benefits, please know that we're working to fix these issues. We will make this right. Today, the world has reached a somber milestone in this pandemic. We've hit 500,000 confirmed virus deaths and 10 million confirmed cases across the globe. States across the nation, like California, Texas, Florida, and Arizona, are seeing surges. In Kansas, we have had 14,443 positive cases, an increase in 905 cases since Friday. And unfortunately, we've had 6 deaths since Friday, bringing our mortality rate to 270. You can see on the graph here that we are now trending upward, and this is not good news. As a state, we've had 210 clusters, 101 of which are currently active. These clusters account for over 6,000 cases, 440 hospitalizations, and 201 deaths. The state of Kansas has added 2 new states to the travel quarantine list. If you visit South Carolina or Florida on or after today, June 29th, we ask you to quarantine for 14 days upon your return to Kansas. Lastly, I've said it before, and I will say it every day until we have a vaccine. COVID-19 is still in our communities, and it is still spreading. Until a vaccine is widely manufactured and distributed, our only defense against COVID-19 is social distancing, maintaining proper hygiene, staying home when you're sick, and wearing a mask. When the pandemic first hit, there was mixed messaging about masks. Now, the evidence could not be clearer. Wearing a mask is not only safe, but it is necessary to avoid another shutdown. When we look at where we are seeing clusters of cases, we are not seeing them in businesses where masks are worn. We have no clusters attributed to barbershops, hair salons, or dental offices. However, we are seeing a significant increase in clusters related to gatherings where masks are not being worn. Remember, your mask protects me, and my mask protects you. If we want a healthy Kansas economy, we need healthy businesses and healthy Kansans. Therefore, I'm announcing that beginning 12:01 a.m. July 3rd, every Kansan in a public space must wear a mask. This doesn't change where you can go or what you can do. It just means if you're around other people, you must wear a mask. That also means if you are outside but social distancing of 6 feet cannot be maintained, you should wear a mask. We'll have very specific guidance for everybody on Thursday. As cases continue to rise, masks are our best defense to keep Kansans at work, to get our kids back to school, and to keep ourselves and our neighbors healthy. We're starting this mandate on Friday, so businesses have the appropriate time to prepare and acquire the proper cloth masks. I know many of you will have questions, and we will release guidance and the executive order on Thursday before the 4th of July festivities begin. The Attorney General's office has been a great partner helping my administration craft executive orders throughout this pandemic, and we will continue to work with him in implementing this policy. I know this is frustrating. I know we all want it to be over, but we're still in it, and we're in it together. Kansans have shown such resilience and compassion throughout this pandemic. I know that we'll all step up to this challenge and slow the spread of the virus to protect our loved ones and keep Kansas open for business. And with that, I'll take questions.
Does this have to go through the State Finance Council?
No,
Your order?
no, it does not. Well, actually, the order does. The ability to do this, is within my authority. But yes, I'll need to take, like I do every executive order, I'll need to take it to State Finance Council.
So to be clear, they can review the order, but they cannot override your decision to issue it.
I would hope that they would not do that. This is in the best interest of all Kansans, including all of their constituents. If they care about their safety and well-being, and if they care about keeping their businesses in their districts open, they won't fight this one.
Governor Kelly, I mean, this has become another political dividing line in this country, mask or no mask. Do you anticipate some pushback either from everyday Kansans or, the Republicans who've been kind of nipping at your heels right along?
Jim, I do expect that there will be some who will be outraged by this order. But I also have been following what's been going on across the country. And more you are seeing even Republican leaders stepping up and mandating the masks. Or giving very clear guidance to folks that this is the one way we have until we have a vaccine to slow the spread of this virus.
Do you hope that local public health officials reinforce your order by doubling down and ordering it in their jurisdictions as well? That
would be terrific, yeah. I would appreciate the support of local public health officials, local elected officials in doing this. Again, for the same reason I think the State Finance Council ought to be all on board, is that we know from the numbers, we have now enough data to really prove that masks work, and no masks doesn't work. So I think it's in everybody's best interest to, as much as I know that people don't like masks, I don't like them either, but it's too bad. The virus is the one who's going to control this, not us, and the mask is a really good protection against the virus, and I think it's important for all of us to recognize that and to just wear a mask.
Is that kind of the biggest change
Just so.
There is you're seeing data on masks? Obviously, you started off with statewide things, then it went to local control. Now it seems like you're stripping local control again. Is it just because the data, or what's changed since?
Well, enforcement of this will remain on the local level, so we're not taking that away. I'm just strongly encouraging our local elected officials and our local public health officials to get on board with this and to reinforce it. I think one of the real problems we've had throughout this pandemic has been mixed messages. And I think this one is one that needs to be very clear and unified, that this is all we've got right now to fight this virus, and it's up to each one of us to do our part.
Given the legislation, and it's still working in terms of what authority you have versus what authority local public health officials have, county commissions, et cetera, is this an order that, if it's going to be enforced at the local level, you can't enforce this order. So is it more of just a recommendation or is it an order?
You know, remember, Jim, that even when I did have the authority, that we still allowed the enforcement to occur on the local level. We did not, bring the troops in to enforce the restrictions. That was always on the local level, and this will continue to be on the local level.
One more question?
On Accenture, I'm going to ask you about Accenture. Can you maybe describe a little bit in terms of, are you actually outsourcing work to them in KDOL? And Accenture was also involved in some projects in Kansas in the past that had a rocky rollout, such as Keys. How confident are you that the services, that they'll provide adequate services?
I am very confident in the work that Accenture has done. I'm very familiar with the Keys project, and I can tell you right now that there was more to that problem than Accenture. In fact, I'd suggest that Accenture was probably our saving grace with all of that, and so I'm very confident that initially what they're doing, and they do have boots on the ground right now, really evaluating our systems and seeing what can be done, knowing that they have experience. We've got folks here who've just come off working with another state, so they have experience with these really vintage systems that don't work, and they've been able to help those states put together programs and whatnot that can work. Whether or not they'll be bringing others in to actually implement, that remains to be seen. It depends upon the evaluation and what they find.
The duration of the contract and the price, you have that, the cost of the contract with Accenture?
I don't have that with me, Jim, but I can assure you that other states, and we will use the CARES Act funding that we got to pay for this. That's exactly what the CARES Act funding was for, to deal with COVID-related issues. And I don't think anybody can deny that the stress on our unemployment system was caused by COVID-19.
So that'll have to go through the state finance council though too, right?
Yeah.
The expenditure.
And are you confident you have the authority to make the $44 million cut or allocation with the juvenile programs?
Well, if you look closely, I don't know if it's out yet, but if you look closely at the allotment statement, it makes it very clear that we need legislative approval on that, as we do with the PMIB loan. So we will be bringing that to the legislature in January.
Thank you.
You can make the cuts up until the